Hello.
How are you?
Surviving.
Dr. Corby knows Jeff, who's in charge of clinic. And who'd you bring with you?
This is my father.
Hi.
Hi, nice to
Jacob
meet you.
Stranix. Nice to meet you.
So,
We'll switch sides so that way we're all facing each other.
Where would you like to start?
well, you just say like where I've been. It's recovery's been more than difficult the past 5 weeks, and I've just kind of been trying to stay alive to come to this meeting. So I've prepared some things. I just want to say, because of your lack of discussion with me about the process and the healing of the surgery, I've wound up with a result that seems to have permanently disabled my genitals and has given me a degree of sexual trauma that I don't know if I'll ever be able to heal from. As such, I've had many questions about the whole process, so that I can better understand your thought process, because you have a lot of experience and many people think highly of you as a surgeon, and yet it seems like you got everything wrong with me without fail. UVA is a higher learning hospital, and everyone should be able to learn from my ruined genitalia how to fix the process. So, problems with the process. One, there was no clear discussion of goals where both parties understood the path. There was no clear explanation of the surgery in detail to me. There was no warning that this disaster was a possible outcome. There was inadequate aftercare because you're overbooked. And I think there's a lack of empathy and understanding of my goals as a transsexual woman. So there are a lot of details in the process and the predicted outcome of the healing process that you did not tell me about, and I'm trying to understand why you thought it was unimportant to tell me those things. I missed all the details. As a result, I'm in a place where my body is much worse than it was when we started surgery. I was trying to get a vulva that looked more natural and less like a surgery site, but now I have one that still looks like a surgery site and is much less functional as genitalia. So you've caused the death of all the skin from the top of the penis. This effectively chopped off the top of the penis and threw it in the trash. You did not allow me to have informed consent, because when I directly asked about the labial alteration, it caused nerve damage. You said, I don't see why that would happen. I want you to know that it would have been less damaging if you'd raped me 100 times than what you actually did to me. This is a gross sexual misconduct of the highest order. I want you to realize this gross misconduct you perpetrated when you did not give me full understanding that this would be a potential outcome. You did tell me there were potential dangers, but you completely glossed over them and provided zero detail as to what they could possibly be. Details aren't necessary to understand the risks, and I did not hear about those. Had you enumerated the risks, it would have been possible to conceive of what they could be. I'm trying to determine what can be done to fix my vulva, enough to make it a life worth living. So what can be done? And then I have all kinds of points as to each point as to what problems have happened. And but I think first you should take a look at it and to see if this is what you expected.
I'll say that this obviously was not where I wanted us to end up, and I'm sorry that we're here. I feel like we discussed things preoperatively, and I executed them exactly how I discussed, but I clearly underestimated the degree of technical detail that I should have potentially gone into.
You said some things, and they made sense to you, but they did not make sense to me, and you did not go into any detail. So in your mind, you discussed them, but in reality, you did not discuss them in a way I could understand the whole way through.
And
that's part of the problem.
And I feel badly that there was a miscommunication at that level. Let me take a look.
Sure.
We'll see.
Okay. Please.
Yeah.
No, I mean, could you write it down?
Oh, yeah, sure. You want it flat?
Yeah, black.
Yeah. There you go.
Mhm. Let's see, where's that? See if I can see it a little bit, okay? We'll take a look, okay? So certainly the labia minora have effaced.
What does that mean?
So it means that, so I put those pleating stitches in. So I'll say no tissue was discarded. Meaning I didn't.
No, I know. It wasn't discarded, but it was destroyed.
Things were lifted up and redraped, but nothing was moved.
Yeah, I know. But it was still killed.
So, in terms of healing, you've healed nicely. There's some residual scar banding here posteriorly. That loss of sort of projection of the labia minora is now just sort of skin redundancy that's there. It all looks nice and healthy. I also very much understand and appreciate that it was not the ideal aesthetic outcome that you were looking for.
Not only, I mean, it's pretty much, it would have been, not only is it a worse aesthetic output, it's much less functional because I've lost about 50% of the feeling to my labia.
On the inner aspect of the labia?
All of that skin you pulled,
Mm-hmm.
I could all feel that die. I felt all of that die and be in extreme pain, and then that has triggered lots of pain from back when I had vaginoplasty.
Okay.
So, to put it in terms that you can maybe understand is if you cut off and cauterized all the skin on the top of your penis, that's what I have.
I am sincerely sorry that you experienced that level of discomfort. I am, because that is certainly was not my intention or what I would have expected to happen.
I didn't think, I don't think you're malicious enough to want to do this, but for whatever, I don't know why you proposed something like that could even result in this, and you never told me it was a possibility.
Partly because that degree of pain and discomfort is not typical for this type of standard revision. That doesn't mean that I don't.
But you knew it was a possibility, and you didn't tell me?
It's unexpected. Honestly, that level of discomfort to the severity that you're describing is not typical for this type of procedure. And so if it was something that is a possible outcome that I'm aware of or was aware of, I certainly would have talked to you about it beforehand, because the last thing I want to do is surprise you with something like that.
Okay. Why didn't you tell me? We talked about the labia minora being 0.5 centimeter. You did not tell me beforehand it was going to shrink. You did not tell me you were going to take basically 2 centimeters on either side to do that.
We discussed that they tend to lose projection a little bit, and that
No,
would be
not in pre-op.
overcorrected.
We never ever discussed that before pre-op. We never had that discussion. You told me that 2 weeks after surgery. After surgery, when I'd already been suffering through that.
It's a pretty standard discussion for me to talk
about that being overcorrected beforehand.
Well, then you failed to do it.
If that's the case, then I apologize. But that is something that's in my normal discussion of this procedure beforehand, because it happens. It's hard to get that to stay totally upright, and
Well,
so
maybe you should have a checklist so this doesn't happen again.
I'll certainly.
I mean, also, you also described this in our pre-op as a loop stitch, which is technical jargon that honestly I didn't understand. Using things that you would talk to another doctor about, it's really not appropriate to talk that way to a patient.
Okay. I'm not familiar with a loop stitch, so I don't know what that means
Well-
either.
Well, that's what you told me in the pre-op.
I
mean, I don't know. Maybe I'm misremembering what you told me, but that's what you told me. No, I also wish we had discussed what the labia would actually look like before going through it, because when I did come out of surgery, I noticed you had cut off the bottom of it, which looks very unnatural. Granted, it's all gone now, but maybe because of the level of trauma I went through. And you also just made it straight all along the side, and which looks very unnatural. So it seems like your goals as a plastic surgeon were not trying to make a natural labia like I wanted. And if you had discussed with me what it was actually going to look like afterward, in detail, maybe I could have raised my hand and said, hey, this isn't going to work. I'm not going to be happy with that.
I did my best to describe the procedure. Clearly, I didn't do it at the level where we reached the same understanding.
Yeah, I'd say so.
And I apologize about that, because that's certainly, like I said, that's not my intention. My intention is to do the best possible job that I can to
Okay.
take care of you. And I was trying my very best to help improve.
Well, maybe you should not rush through it then. Talk about it more in detail, the whole process. Like, you didn't even talk to me about, I mean, we've already gone over the healing process, which that was a horrible shock to, wake up from surgery and see something, and then have to live with that until I saw you the next time. But that just wasn't even at all what we talked about. So it's like this whole experience has just been an assault. The other thing I'm having problems with now is it's really difficult for me to sit for more than 10 minutes without having blood flow problems to my labia. I think from all the scarring. I don't know if anything can be done about that, but it's very difficult, and you should know that's a possible outcome. When I went through all of my records for the meeting notes, you didn't really protect patient rights at all. It said that I was given warnings, but it was clearly not the case. Things did not work out very well, and they were very undetailed. There was not all of the detail that was discussed. It was just a couple of lines here and there. If I had been giving all of the proper warning signs, I think, then I would not have gone through with the surgery, which has been a complete horseshow, and I'll probably never be able to enjoy sex again. Regarding the vaginal entrance, the surgical intervention has done nothing to improve the function or use of my vagina. Skin still covers the entrance in some positions and only works well on my back. So in several other positions, the entrance to my vagina is covered by skin from the perineum, and I'm concerned that you did not think about skin tension and position when doing those alterations.
I believe it was a 4 to 5 centimeter release of your redundant posterior skin, which is a significant release.
Well, it hasn't been noticeable.
And I'm sorry that it didn't achieve the degree of correction that you were looking for.
Yeah. It's the fat grafting. You didn't mention the lipo process actually right before surgery. That's another issue. It was only mentioned casually right before in the pre-op. Because of where you took the fat graft from, you've made my belly look more masculine, which I'm not happy about. Before surgery, you told me the area I wanted would not work, but the area you chose was also not appropriate. The location may have been easier for you, but it was completely inappropriate from the point of view of female fat distribution, which is so critical for a trans woman. I think it would have been obvious this would be a terrible result, but I guess it wasn't. And it's just made my body dysmorphia worse. I'm afraid I may need more liposuction, but I really don't want to get it. And I guess the other thing is, you never really discussed with me the loss of fat in the pre-op, that there would be a significant reduction,
It
or the
has
healing process of being over a year.
It has about a 50 to 70% take, and that process takes about 6 to 9 months to declare itself. And that, and again, is part of our routine discussion with fat grafting.
Well, yeah, it was not enough discussion. And we may want to rethink how you do that, for sure, because it's very problematic. I guess the other thing is, so what can be done about all my nerve damage?
Nerves take time to recover after surgical procedures.
Yeah, I know, but I mean, all that skin is gone.
No skin was removed.
Yeah, it's not removed, but it's gone.
I'm not sure where it could have gone because I didn't remove any skin.
No, my labia kept shrinking and shrinking and shrinking until now it's just one linear scar.
The labia itself were just elevated from the same incision that I did the posterior release. So I didn't make any new labial incisions.
I'm not talking about incisions.
Okay, sorry, you said incision. I'm just trying to understand.
No, the skin.
Mm-hmm.
The skin you pulled up.
Right, the skin that was pleated together.
Yeah.
Mm-hmm.
Yeah.
That has now
gone away.
It's just, it was pulled together and now unfortunately has fallen back down.
No, it didn't fall down. You're completely crazy if you believe that.
Okay.
What did it do?
It shrank and shrank and shrank until now it's just a line, a scar line. I have pictures of the whole process taken daily, and you can watch it shrink. And so now it's gone. So it didn't fall down. I'm just letting you know the body ate it because it was so damaged.
Could I say something? Sure. So just before we came, Valentine said to me that her main objective here, well, there were a couple of them, but the main one was to make sure you understood what had happened to her so it didn't happen to somebody else. Okay, just wanted you to know that.
And I appreciate the feedback. I'm
And
constantly
now,
trying to improve.
great. And now she's on her second point, basically, which was, is there anything that can be done to restore the functionality, the sensation in skin that is now
Because
numb?
I've been, I've had to go on a lot of anti-pain medication. I've been suicidal because of the pain. And now it's just like an absence. It's like everything's been cut off and gone, and it's not even numb, it's just gone.
So from a nerve recovery standpoint, that takes time. And unfortunately, there are not a lot of great medical options to treat nerve-related pain. And certainly,
Well, it's not even, pain isn't even the worst part. It's worse than pain.
and certainly I would be hesitant to offer any additional procedures.
I'm not even looking for surgery necessarily.
And I'm just going through options.
Okay.
So, unfortunately, most of the time, it just takes time for this nerve-related pain to recover. If that type of pain that you're talking about, I don't know the best way to handle that.
Okay. So it's just a loss.
I'm sorry that we find ourselves in this situation, because it certainly was not my intention in the least bit. And I did the procedure to my technical best,
Okay.
and it was what I thought a well-executed procedure in a very safe manner.
So why is this is a common procedure that works for other people?
It does.
I'm just surprised because I wish you'd talked to. Did you read the records on my vaginoplasty? Coming from that?
We didn't have your op notes from 2014.
That's all. They should have had those. I had everything transferred from my doctor quite a while ago. But anyway, you could have asked me, and she had done something similar to make a labia minora with the exact same result. If you'd done your homework, you might have been able to avoid it.
And oftentimes in a revision, better projection is achieved in that scenario. Unfortunately, that was not the case here.
Right, I just got a lot more scar tissue and more pain. Thank you. I don't know why you would, ever suggest such a horror. But okay. So you can't do anything for me?
Well, I don't have any surgical options to help.
Well, I wasn't asking for surgery. But I guess the other question is, how can UVA change to make sure this doesn't happen again?
We can improve our preoperative counseling and education protocols.
I think that's important.
Yeah. And do a better job of communicating post-operatively as well.
Yeah, well, I think you should also look at your scheduling to make sure there's enough availability. You thought you were a lot more available than you actually are. It shows me you're not aware of what your schedule is. Okay. That's all I have.
What do you think the chances are of a nerve recovery at this point?
I would expect it to recover because it was a very superficial skin procedure. There was no underlying structures that were violated. And that's also honestly why I am surprised that you have the degree of discomfort that you do. Because it was a very superficial skin-only procedure.
Yeah.
And so I would anticipate return of sensation. But like I said, your post-operative recovery course was unexpected from a pain standpoint. And so I'm hesitant to make any promises in this scenario.
Right. No, I mean, that makes sense because it definitely felt like all those nerves died. I don't know if they did, but it felt like it.
And I'm sorry that you've had to go through that.
If nerve recovery is more than a faraway possibility, is there any such thing as physical therapy for the vagina?
There
Or
are pelvic floor therapists, certainly.
okay,
Well, I don't think that's the problem, though.
oh, okay, well,
My pelvic floor is fine. It's neurological. I don't know. I asked about seeing a neurologist, but I was told that that's probably not going to be helpful.
Neurologist?
Yeah.
You're still relatively early in the postoperative period.
Okay.
If you have persistent discomfort once you're 6 months out, then we can certainly, and honestly, even earlier than that, we can refer you to pain medicine.
I've already been referred.
I forgot about that. That appointment is not for until next month, right?
Yeah, that's a while off. The only thing that's saved me so far has been my psychiatrist putting me on some Volta.
Okay. And Cymbalta can help with nerve-related pain. Has that helped a little bit?
This helps a lot.
Good. Okay. And Catherine Casey was also helping you out too with stuff as well, right?
I saw her, and
Yeah.
I saw my regular doctor who's back from vacation. But
Nick Kidd, right?
yeah,
Yeah.
they haven't been able to help really.
Okay. Well, I'm glad the Cymbalta is helping you.
Yeah.
So
There was a strange interaction between Cymbalta and gabapentin that was making the numbness worse.
Interesting. Okay. Well, so pain management would be the first place to start. I'm glad that we're able to find something that's helpful in the meantime with Cymbalta.
Mm-hmm.
I'm sorry, I didn't think of that. And then I would defer to the pain medicine doctors in terms of, management and next steps.
Okay, yeah, well, I said the pain's not really the problem. Okay. I'm at a loss.
Well, I'm sorry this has been your experience. I truly am. Okay. I was and continue to still try to help, although I have not been quite helpful to you. So I apologize about that. I'm not used to falling on that side of things.
Okay,
But I am here to help, I promise.
okay.
We appreciate you sharing your perspective.
Yeah.
Yeah, it's only going to help us with the program.
Good,
So.
good.
Thank you.
Yeah, absolutely. Okay.
Do you want to come back and see us? You don't need to make that decision.
Well, I guess, what would it get me? What is the benefit?
I understand. And so all I'm saying is I'm here to help.
No, I get
If
that.
you-
I'm
if
just
you-
trying to figure out practically.
So the other thing that I would say
Where am
is,
going forward?
so I feel like our surgical relationship probably is compromised a little bit at this point, because I can understand why you would have a loss of faith in
Oh, yeah.
my abilities.
For sure.
So the next step I would think is, I'm happy to refer you to Ramanini in DC, who does vaginoplasty up there, to see if he potentially has options if you wish to pursue any additional procedures.
Yeah, well, I think it'd be worthwhile talking to somebody else,
Yeah.
considering the situation.
So let me reach out to him and see if we can have him get you in for a visit, okay?
Okay.
And then we're here, but I also understand.
Yeah, I mean, I just, you saw it's very well healed. Too well healed. So,
Yeah.
you want to leave a copy of your notes?
yeah, I'll leave a couple minutes.
They were forwarded to me. I read them.
Oh, these are updated.
Okay.
We probably don't have the updates.
Yeah, we can certainly take them.
Thank you.
Thank you. Okay. Well, I will. Are you okay if I give Dr. Romanini your information for his office to reach out?
Sure. That's okay.
I will do that.
Okay, thanks. Yeah, I don't know if to take my insurance, but we'll see.
Okay.
All right, well,
Thank you,
goodbye.
guys.
Thank you.
Yeah, thanks, you guys. Thank you so much.
Sure.
Oh. Well, that went about the way I thought it would. You were great.
Oh, well, thanks. I'm splitting headache now.
Yeah, I'm sure that's true. You can't have a gin and tonic.
Oh God, that makes my head hurt more. I thought about going back to drinking through all of this, and I'm just like, no, that just makes me feel worse. You know, like
Yeah.
I can't.
Yeah.
I don't even want to.